Hi, I'm attorney Doris DK coming to you from DK Law Group. And here's the one thing we're going to discuss in this video today. And it's bonus compensation for your healthcare team for the great job they're doing in your business, essentially paying them for seeing more patients. You've got a busy healthcare business. You're doing great. Your marketing is working. You've got patients flooding your organization. So you've hired more physicians, NPs, PAs to see the patients to ease off the stress on you. And it's been great. You're able to see more patients. You're able to get more administrative stuff done in your business. Your business is running effectively and you're making more money. But now your providers, your physicians, your NPs, your PAs, they want more money. They've been doing good work and they've been seeing a lot of patients. And you want to compensate them because you know it's a tight job market and they can get a job somewhere else. So what do? Well, consider Good Shepherd Hospice and the over $4 million settlement that they had to pay to the government for paying their providers or incentivizing providers for seeing additional patients. Now, I will say that this hospice organization was doing more than just paying for patients. They were also falsely billing. But the US government contributed a lot of their bad behavior to incentivizing providers and paying them more money for seeing more patients and basically being paid for referrals. They were pushed to be staffing and putting more people in the organization so they can meet their patient quota. Now, there are exceptions to the anti-kickback law. This is what really this touches. And one of the exceptions is having a bona fide employee. However, you have to meet the entire exception rule, not just you just hire an employee, but every single requirement of that. And even if you do, the government is still going to look at you with some level of scrutiny. The best approach is coming up with some other metric to incentivize your employees for doing a good job. You might consider KPIs. You might consider paying your employees for bringing positive and a better team environment to your healthcare organization. So they're incentivized to not only do a good job, but to encourage the other employees to show up on time, be diligent with their work, and just being good overall employees. Now, what have I taught you today in this video? Number one, paying your employees additional bonuses for seeing more patients is not the way to go, even if they're a bona fide employee. Now, you might be thinking, well, that is an exception to the anti-kickback rule. Why can't I do that? It's an exception, which means that in order to fit in that exception, you've got to meet every single requirement. And some organizations still do pay bonuses based on patients, but they try diligently to meet every single requirement. A better approach is to find another metric to incentivize your employees that is not based on patient or volume or level of services that you're requiring. The government does not want clinics, hospitals, or other organizations just giving everybody the same medication because they know it makes more money, or having like some chain effect of everybody getting the same thing because you're making more revenue. This isn't a pizza shop. It's a medical practice where every level of care is given to a patient depending on what service they need to receive. If you're incentivizing your employees by paying them more for offering more money for a higher level of care, or you're offering them more money for seeing more patients, it usually veers off into illegal activity, and the government wants to prevent that. So if you have any questions about your business model, what you're doing, or you're trying to keep the government at bay, reach out to me at dorismeet.com or dklawg.com. I'd be happy to help review your business model and offer you a legal opinion to see if what you're doing makes sense for your business to keep the government out of your pocketbook. Thanks so much. Bye.